Float therapy allows you to basically shut off any outside stimulation and allows you to kind of, get into a bit of a meditative state. Meditation has been shown to be effective for the relief of post-concussion symptoms. And this has to do with a lot of the psychological components of persistent concussion symptoms. So things like anxiety, increased stimulation, all of this stuff that causes or can increase persistent concussion symptoms could potentially be helped through something like float therapy. Now, again, no research on float therapy in particular, but I have had a number of patients that have told me that after they go to float therapy, they feel so much better for a few days. Now, is this because they've been floating in a hypertonic solution of very high density salt water? Or is it because they had a chance to completely shut their mind off and get into a meditative state, for a good half hour to an hour? And I think it's probably more on the meditation side. So you can do meditation without having the float, and it might be just as effective. There's not any research that I've come across on float therapy specifically. So unfortunately, we don't really know.